Hi, and welcome to your next update for PT 751. By now, you should have selected a case for your case report and hopefully have started some of the peaks for Basecamp. I've had a few questions come in over the last couple of weeks regarding patient selection, so I just want to talk about those in a little more detail. First, once you've selected a case, you don't necessarily need to send an email to myself or Dr. Plisky. As long as you have, attempted to get the informed consent signed and, your patient obviously agrees to work with you, then you're good. You don't need to communicate any further with us unless you run into any issues. Most people have selected a case. If you haven't already, please reach out to Dr. Plisky or myself so that we can come up with a plan for when that case is going to be selected and make sure that you don't get overwhelmed with the timeline. We just don't want anybody to get behind and feel panicked about trying to get everything done this semester. Once you've selected your case, many of you have moved on to starting your literature review. One of the questions that I've gotten so far has been, are systematic reviews okay to use for the lit review? And if so, how do I cite them? That's a really great question. Systematic reviews, I would highly encourage you to use for your lit review. That's a really great way for you to compile a lot of information and, really, really efficiently. The difficulty comes in how to cite that whenever you're utilizing it for your lit review. So one of the things that I always think about is what is the information you are pulling from that systematic review or meta-analysis. If it's overarching conclusions, which often that's what they're designed to do, is help make sense of a lot of studies, those overarching conclusions are that of the systematic review. So you would cite the systematic review or the meta-analysis. So if it's data from them, conclusions from them, it's okay to cite the authors that are doing the systematic review or meta-analysis. However, if those authors cite specific data from a particular article, and that's the information you're using, then you need to go find that article. First and foremost, just to verify that that information is correct. It's possible that even though they pulled information from this article, and we would like to trust the researchers, mistakes happen. And so we want to verify that the data they've reported is consistent with what was reported in the original article. Additionally, it's helpful to see what kind of analyses they did and just make sure that is the information, that information is correct. Additionally, that is the appropriate citation. If you're pulling data from a particular article and not the overarching results from a systematic review, then you have to cite the specific article that the data came from. Next questions are related to some of the mechanics of the case. So in some cases, we've had, as I talked about before, pediatric cases where the previous evaluation happened last month. They aren't going to be due for another one in like 2 more months, and by then I'll be done. It's okay to use information from the most recent progress report as sort of your baseline, but I would take some of the objective measures that were collected during that the most recent progress note and utilize that again at some point to check progress. So it doesn't have to be all the objective measures, because I know in some of the pediatric pediatric settings, those objective measures are things like the BOT that are really, really lengthy, and you're not going to get a chance to do all of them, but take pieces of them to help establish that the treatments you are providing for your patient are effective, and here's how you're tracking that progress. In some cases, people have selected patients that they did portions of the evaluation with, but not the entire evaluation. That's okay too. In other cases, the student has done the full evaluation and the patient got discharged in the meantime. And so, you're kind of having to expand on what you think the treatment should have been, should have included. That's okay too. So even though you didn't get to necessarily carry out the plan of care that the research indicates would be most beneficial for them, we still want to be able to talk about what that treatment should have included within your article or within your case report. I have had a situation where one student was, playing a role in collecting some of the objective information as part of the evaluation, but no real other established evidence-based outcomes were collected. So, maybe it was just, a neuroscreen, manual muscle testing, and gross range of motion, and then they just kind of walked in the sort of sort of an acute care setting and no other outcomes that, you've learned in school were really established. That's okay too. Make sure you summarize what really happened, but then also talk about here's what I know from the evidence. We should have collected these outcomes. This is what the evidence says is the most beneficial outcome for this patient population. Go ahead and include that. Even if it didn't happen, include it so that we know that, you're pulling together all the information that you've learned. If you have any other questions about the case report, please let us know. Again, start working on Basecamp 2 if you haven't started. Need to start building that into your weekly schedule. If you're struggling to come up with a weekly schedule, please reach out to myself or Dr. Plisky. I'll keep an eye on Blackboard for any questions that are coming through there, and I'm trying to respond to them as soon as I see them. Otherwise, keep reaching out and keep asking questions, and we hope to talk to you soon. Bye.